my name is Brie Abbe. I'm one of the nurses at MDI Hospital in the maternity unit, and I'm also one of the childbirth educators. Catherine Shaw, who's not here today, and I wanted to make sure that everyone who was planning on having their baby with us had a little bit of a sense of what our unit looked like. Typically, we would offer a tour, but in this troubling and difficult times, it's just not the safest thing to do. So we thought we would do a video tour so everyone feels like they get to see this beautiful space that we're excited you're going to be coming to. We're going to start with the birth room, and I'll explain it to you in a little bit, but let's just first see what it looks like. One thing I think you would like to see is our labor tub. This is here over in the corner. It is where pregnant people can labor and have their babies. Now, it's important that you speak to your provider to ask if you're a candidate for this, but it's important also that you know it's an option. Right here is our fetal monitor. This is what we use to monitor the heartbeat of your baby while you're in labor. It is not always used. We in our unit practice a combination of fetal monitoring and intermittent auscultation. You're probably familiar with auscultation when you're with your provider and they listen with the little Doppler. That is what we also sometimes use in labor, but if needed, the fetal monitor is right here, and it's pretty straightforward. It's got two parts that go on your belly. One listens to the heart of the baby and one feels the contractions. But for the most part, we try to minimize the use of this and improve your movement and let you move around more by listening to the baby through auscultation. And the last thing I wanted to show you is the infant warmer. As you can see, this has got warm blankets for the baby and a radiant heater. I would say that about 90% of the babies will never even come close to this monitor, and that's because we promote and practice skin to skin immediately after delivery. That is the way that we like to warm babies and keep them safe, and for the most part, that is the safest place for the baby immediately after birth. However, we always have the warmer ready in case we need to do any kind of help in terms of assessment or evaluation or any resuscitation for the baby, and that does happen in the warmer if need be. Just so you know, skin to skin is the primary way in which babies are born immediately into mom's arms, and that is normally where they're warmed. This is our postpartum room. We call it our family room because it's set up for the family to support the mother and the baby. The baby stays in the room most of the time in a bassinet, and there's room for both mom and partner to sleep and enjoy their baby together. This is our nursery. As you notice, there aren't a lot of babies in it. That's because it's a very small room. We really promote rooming in with families, and this room is used only when we need it. We have the ability to weigh the baby and do all the evaluations in the parent's arms and in the room, and sometimes we do procedures in here. But for the most part, this room is just where we store and have access to the things that we need for the babies. Thank you so much for coming with me on this tour. We are so excited to meet you and to welcome your family to our unit. We know this time is not exactly how you planned, but we are doing everything we can to make it as magical as it should be.